Hello again, everyone. I'd like to welcome you to today's class, in which we will be discussing promoting residents, specifically how to maintain and promote residents' dignity, independence, privacy, individuality, and choice. My name is Deontay Marquis. I am a family nurse practitioner, and I've been practicing as a registered nurse for the past decade. And I will be your educator for today on behalf of my ALFtraining.com. So let's begin. So here are our course objectives for today. Now they're all the same, but each of these terms pertains to a very specific course of actions that we're going to talk about today. And I want you guys to understand specifically why each of these topics is important to making sure we have happy, healthy residents and we're respecting this very special moment in their life, very difficult time in their life when they may be transitioning or have transitioned to live outside of their home in a care facility. So, first, we're going to understand the importance of maintaining and how to promote dignity among our residents. And then we're also going to follow with independence, privacy, individuality, and choice. So, all of these topics combined is going to make sure that we're not only providing our patients the top level of care that they deserve, but also we are catering to their life as an individual, as a respected elderly individual in, as I said, this special stage in their life when they're transitioning to assisted living facility or some type of residential care facility. And at the end, I will have a short quiz for you guys to test your knowledge to make sure that not only were you paying attention to today's presentation, but you were retaining the key parts of the presentation that I wanted you guys to take away today. So without further ado, let's begin. So the theme that I laid out for today is doing things with them and not for them. Because I've been a nurse and I understand that sometimes it's difficult for us to do things with the patient as opposed to doing things for them, especially when sometimes you're caring for patients who can't do certain things. So you go from doing activities or daily life assisted activities for a certain patient because they can't do them. And then you go help another patient who can do them but may need a little bit of help. It's sometimes hard to individualize the level of support that we give that second patient or that first patient. So, the theme of this presentation is doing things with them, not for them. So, we always want to get into the habit of doing things with the resident and not doing them for them. And I'll explain to you in a bit why this is so important and more on why I chose this as the theme for today's presentation. But first, I'd like us to watch a short video, which I really enjoyed and I felt like exemplified that theme very well. So let's begin.
As a caregiver, your instinct is to give the person you're caring for as much help as you can. But did you know that it's possible to help them too much? Giving someone more support than they need can cause them to become dependent and reduce their ability to care for themselves. In this video, we'll explore why independence matters and give you a few tips on how you can encourage the person you're caring for to be more independent in their daily life. When you spend a lot of time taking care of someone, you can get into the habit of doing things for them rather than with them. Maybe you think you're making it easier on them, or you believe you'll get everything done faster if you do it yourself. But you might be surprised by how much the person you're caring for is capable of doing on their own. Allowing them to be independent is good for both of you. They'll feel like they have more control over their life, and you'll have a few less tasks to worry about. A good place to start is by thinking about all the different ways the person you're caring for can be involved in your daily caregiving routine. Some examples include brushing their hair, folding their laundry, getting a glass of water, or answering the phone. After you've come up with a few things they can handle on their own, sit down with them and discuss it. Make it clear that you want them to be as independent as possible and that you'll be there to help them if they need it. Try to set realistic goals that the two of you can work on together. Once your new routine is underway, make sure to celebrate their accomplishments. Be impressed when they show independence, and let them know what they're doing is a good job. Giving positive feedback will go a long way. It's important to know that you don't need to figure this all out on your own. There are healthcare professionals whose whole job is to help the person you're caring for be more independent. A physiotherapist can give them training to improve their motor skills, balance, and coordination, while an occupational therapist will help them work on self care and everyday tasks. If the person you're caring for doesn't already have one of these professionals, contact your local government healthcare access center and request an in home assessment. You should take every opportunity to give the person you're caring for more personal freedom, no matter how small it may be. For example, rather than asking them what they'd like to watch on TV, give them the remote control and allow them to find something on their own. Anything you can do to shift your caregiving role from one of control to one of support is a good thing. By promoting independence, you'll help to increase both the confidence and the happiness of the person you're caring for. Although some
Okay, so I'll stop it there. On the last thing he said was by helping the patients do more, or the residents do more on their own, we can increase their independence and their happiness. And this is very true. And we'll talk a bit more about independence specifically, which is a key component of maintaining resident happiness. And it's a very, not very, but it's a more complex idea to grab around and to implement into your practice. So let's talk about it a bit. So, what is independence for residents? I know what independence is for you and I, but what's independence for a resident? For someone who, to some extent, has recognized that they're losing their ability to do things for themselves, or they're doing things for themselves may pose a safety risk, and they're in this transitional point in their life. What is independence to this person? And independence for them is basically having a safe lifestyle with minimal amount of assistance. It's living, this type of living, independent living, is ideal for individuals who can still live independently, but enjoy having access to assistance for certain activities that they may not be able to do by themselves, or maybe they can do it by themselves, but it's become very difficult because maybe they have significant back pain, or they've had surgery on their leg, or they have some type of limiting disease, or just chronic pain that makes it very difficult. So they enjoy having access to someone who's reliable, who's a healthcare professional, who can assist them with these activities. Without losing complete independence. So that is what we can define independence as. Now, when people lose their independence and they lose that ability to do things for themselves, whether it's to an extent of 1 or an extent of 10, they start to lose some of that self-esteem in themselves because they're recognizing that they can't do things that they could do all their lives. So it isn't always a smooth transition. Now, when a resident starts to lose, or an individual starts to lose their sense of independence completely, they also experience other feelings that go along with it. So they start to feel hopeless. They start to feel hopeless that, oh, I'll never be able to go up the steps again. I'll never be able to live alone again. I'll never be able to feed myself again. And they start to feel depressed about that hopelessness. Depression also starts to set in. And we all know that depression can also have physical effects on a person's body. So we may notice some physical effects of the depression and the hopelessness setting in because they've lost their independence, because they're losing that self-esteem. And those physical elements could be weight gain or weight loss, or maybe increased incontinence due to the stress that causes them. And also they're going to start feeling helpless, of course, because they just feel like I can't do it anymore. It's too difficult. They've become reliant on the help that they've been getting to complete whatever activity it is that they're no longer able to do themselves. So they start to feel helpless and they don't even want to try at all because of the hopelessness and depression. And this all, again, is stemming from a loss of their independence and a loss of their self esteem for themselves. Now, this can lead to a community of residents with higher care needs. And this is a less desirable living environment. And also, it's less desirable for us to work in, where everyone has low self esteem and the care needs are increasingly higher. So we want to create an environment where the residents enjoy living. It's desirable because everyone wants to maintain that independence, and of course, us as their caregivers feel compelled to give as much independence as we can back to them and restore their self-esteem, restore that sense of pride in themselves. So I included this fact here about self-esteem, and self-esteem naturally increases throughout adulthood and starts to peak at age 60. And after age 60, it starts to decline a bit. And at age 60, that correlates to physical ailments really start to catch up with us, our overall health. If we've been taking care of ourselves, exercising, eating properly, then those physical elements start to really catch up with people and place limits on their ability or their need for care around that age. So that's when self esteem starts to decrease. Now, decreased engagement, weight gain, weight loss, refusing medications or treatment, aggressive behavior, neglecting hygiene, and even suicidal ideation. These are all associated behaviors that come from when an individual loses their sense of independence and their self esteem. So these are how we may see this manifesting when someone who comes into our facility that has just lost their independence and is struggling to regain it. This should clue us in that this particular person really needs our help in regaining their confidence in themselves. And how can we give them back that confidence in themselves? We can give it back through restoring their independence because independence directly affects someone's self-esteem. We talked about on the last slide. So, examples of some common areas where patients feel as though they've lost their independence. So, what part of a resident's life do they feel the most helpless? And that would be, of course, the activities that we do most commonly throughout the day. So they're constantly being shown that they no longer have the ability to do this activity. So that would be eating, something that we do several times a day. If a resident needs assistance with eating, then they're really going to feel that sense of helplessness and hopelessness and start to doubt themselves and really lose their independence. So that is the first feature of giving back independence we're going to talk about today. Second is self-care tasks. So bathing, hygiene, dressing. Bathing, residents only maybe do this once a day, or some twice a day. Hygiene, brushing the teeth in the morning, brushing the teeth at night, and dressing, that's once a day. So it doesn't occur as often as eating. So eating is definitely number one. And last but not least, the third high risk area where residents lose their independence is in making healthcare decisions. And this is a little bit more of a simple task compared to eating and self-care and in regards to how we can give residents back independence with regard to making healthcare decisions, because there are a couple changes we can make to how we care for and present healthcare decisions to the resident that can change that. So let's first start with, in my opinion, the most difficult because it occurs the most often, and that would be eating independence. It's most difficult to maintain because each resident has different problems with eating, and they are to varying degrees. So, if you remember, I talked about in the beginning of this presentation when we first started, I talked about the problem we may face in knowing how to scale the assistance we give to one resident, and then we move on to the next, and we're struggling to dial in the specific or unique amount of assistance that resident may need when we've just finished helping this resident who needed a lot. So we're trying not to give resident two too much assistance because we don't want them to feel like we're imposing upon their independence. We want them to do more because that's the best way to retain their independence, is to having them do as much as they can. So we can give back independence through changes in three specific areas of care, and they are environmental, social, and individual. Well, what does that mean? Those three areas. What do those three areas mean? Well, I prepared this slide here. It talks about those three different areas of care that we need to change and be mindful of in order to give residents back their sense of independence. So the first area is going to be environmental, right? So what can we do? What can we do to give patients back uh, their independence in terms of making environmental changes? What does that mean, environmental changes? Well, that means that we want to do things that make them feel like they're being served and less of being assisted. So, for instance, we want to set the table in advance, like they're at a restaurant. Because if I sit down at a table and I'm already feeling hopeless because I know I'm going to need assistance with feeding myself, it's kind of nice to sit and have everything in front of me as if I'm at a restaurant, as opposed to someone bringing me my food. And then I have to wait for them to bring me a spoon and a fork and then sit down and help feed me, right? So we want to set the table in advance. And it's just small changes, but it can slowly help the patient make little decisions that's going to make them feel like they're in some control and they do have some of their independence and their ability left. Okay. Next, another change is we want to signal mealtime, like ringing a bell or opening doors to give the patient the choice of when they want to enter into the facility to eat, instead of going to get them and walking them in, or going to their room and telling them. It feels like they're being served. It makes them feel almost like, they're our children and we're taking care of them, knocking on, when we were younger, our parents knocking on our door telling us dinner's ready, as opposed to being in a hotel and walking by the hotel restaurant and seeing that it's open and walking in to eat when I'm ready to sit down and eat, and sitting down and the silverware is there and all I have to do is wait for my food to be served. And last, we want to decrease distraction, stimuli. So we want to make sure that they're not being distracted. So the goal here in environmental changes is, when you're thinking about how you can make environmental changes to give the resident back their independence, is you want to make them feel less assisted. Any opportunity you have to give them the ability to make little decisions can result in increased feelings of independence. So the um, next level is social. So we want to make social changes as well to help restore resident independence. So what does that mean? Well, we want to change the structure of social settings. So we want to make sure that when they're sitting down to eat, we're modulating patient surveillance and intensity. This simply means that we're not sitting there staring at the patient, at the resident that needs the most assistance, because the resident that needs the most assistance may be seated at a table with the resident who needs the least amount of assistance. And if we're standing there harping over them, they're not going to feel very independent. They're going to feel like, you know, they're children at the kids' table, being cared for instead of being assisted. Now, that leads me into point number two is we want to make sure that the groups that they're seated with to eat, they all share similar level of independence. This way we can avoid um, issues with one resident needing increased level of surveillance at an increased intensity, opposed to another one, and imposing on the more independent residents independence. And then structure the area to maintain positive interaction. So if the resident wants to eat with their friends, we want to make sure we do the best we can to accommodate their wishes. And if they want to dine alone, we want to make sure we give them that option, because it's that little decision that makes them feel independent, even though they may be experiencing some depression. And let's say we know that they are, we want to give them that option, because it not only gives them a sense of independence, but it gives them choice, and it acknowledges their right to do so and their dignity. And we'll get more to those topics later. So the goal for the social eating, in terms of restoring a patient's independence, is we want to make sure we balance the level of independence in the group while residents are eating. And we want to make sure, as always, we give them the option to make little decisions. And last but not least, individual level. We want to make sure we're catering to resident independence on an individual level. This means giving them meal preferences, getting to know the resident, what they like, what they dislike, making sure we present options to them ahead of time so they have something to look forward to. They anticipate being served their favorite meal, or the favorite side dish of their meal, or the favorite dessert, and allow them to make little decisions if they want to change small things about it. Then we need to do that. And overall, just make sure they feel as though they're being served and not assisted. Now, the next common areas where patients may feel like they're losing their independence would be self care and healthcare decisions, which aren't as complex as eating in terms of giving, not complex, but multi layered in restoring a resident's independence. So, when we're talking about self care, we want to make sure that we're encouraging the patient to do things independently, because as we saw in the video, when we encourage the patient to do things independently, it is the main way to help preserve their ability to do things independently, by making them think and use those muscles and do the different activities and maintain some responsibility. It reinforces the idea that I'm here to assist you with these activities as needed, not to just do them for you. Okay? So the self-care, if you want to make sure they know that we're there to assist and not do them for you. As opposed to eating, we want to make sure that they know we are here to serve you, not to assist you so much, unless of course they need that level of assistance. So how can we help foster independence and self-care? The same that we did with eating, where we set the table for them. With self-care, we can prearrange items that they may need. And again, this feel as though they're being served and not so much being cared for. So if they told us they want to shave that day, then we have the shaving cream, a towel, a razor, the mirror is ready, the area is clean, everything they may need, so that they can do it on themselves without waiting for us so much. And last but not least, a common area where residents may feel as though they've lost their independence is healthcare decisions. And of course, they're going to feel as though they've lost the ability to make healthcare decisions, because they're most likely dealing with so many emotions about their own health. Things are going awry that they did not plan for. Maybe they didn't want to go to the living facility, but that decision was made for them. or strongly pushed upon them by doctors or family or friends. So once they're in our care or our facility, we want to make sure that we give them back that independence. We encourage and applaud their participation in decision making regarding their health. We want to make sure we're sharing knowledge with them, even if it may feel as though they're not understanding it 100%. By all means, we want to try to help them understand it, but it may be beyond their mental or physical capabilities for them to understand it. And we want to basically follow the model of sharing any piece of the pie that the resident can stomach. So as long as the information that we're giving them isn't overwhelming, it isn't too much for them, that they haven't told us they don't want to know, that we're telling them the information, we're involving them in those decisions, and that's going to make them feel like they're the most important part of making these healthcare decisions, because they're who we are making these decisions for and about. So we want to make sure that they're included and help restore that level of independence, recognizing that they are the most important part of the puzzle here. So we've talked about the different levels in maintaining independence for the resident, the three different levels: environmental, social, and individual, and also the three most common areas where residents tend to lose their level of independence. And we also define independence. So now we're going to move on to preserving resident dignity. Now, what is dignity? Dignity is the quality or state of being worthy, honored, or esteemed. That makes a lot of sense. Dignity is when we honor someone or we make them feel as though they are esteemed, because they are. And seniors uh, of our facilities, they are esteemed individuals of society. So, what does a loss of one's dignity feel like to a resident? It can come in different forms. It can be worded as neglect, worthless, shameful, or giving off a feeling that they've become a nuisance to be cared for if they need a lot of care or it's difficult to care for them. Maintaining respect and understand and sympathize with the possible embarrassment that they have. This is something we should do to maintain their honor, is sympathize with the possible embarrassment, they even if they say that they aren't embarrassed, or we don't get a sense that they're embarrassed. We want to make sure that this is put out there, that we recognize that this may be embarrassing for them, and that we're treating the situation with as much respect and dignity, trying to maintain that dignity as best we can in an embarrassing situation. And that is what they need our help for because of their inabilities. But we're there to help them, even though they have these, and we still respect and honor them. So what are some ways we can preserve a resident's dignity specifically? um, Encouraging them to do things for themselves, that recognizes that they're able to do them, and this will translate to increased self-esteem as it does through increased independence. So you see how this is all connected together. By doing one, it has a domino effect on the other. We want to allow the patient to dress, bathe, and clean themselves as much as they can, And of course, when they're doing these activities, or we're assisting them or standing by for assistance, we want to keep them covered. We want to keep doors closed. And we also want to make sure that they feel as comfortable as possible. And that's also something we'll talk a bit more about when we get into how to preserve a resident's privacy. So you see, they're all connected together, and they're all, no one part is more important than another. Dignity would also mean respecting their personal space and possessions. So even if the resident's room may become messy, we want to make sure we respect their personal space and possessions, and don't touch their things or move their things around, not only without their permission, but without them being present. We want to make sure that we're not cleaning their room for them, even though it has the best intention. It can be interpreted wrong, and it can impose upon that resident's dignity. Um, and last but not least, we want to promote social activities so the residents don't feel as though they're becoming a burden, to still retain some sense of self-esteem and worthiness, that they're not just something there that we have to care for, that they're still a person and they are to be enjoyed and honored. So, preserving resident dignity. What else can we do? More specific. I want to be very specific with you guys. Activities we can do. So, what can we do on a day-to-day basis? Honor their clothing choice. Let's say the patient picked out something that we don't think is suitable for the weather or for the activity. We want to honor their clothing choice regardless. If the patient has a catheter, we want to offer to cover that catheter bag for them or suggest clothing that may cover the catheter bag. Um, we don't just want to assume that since it's not covered that they're not worried about it. We want to make sure that they know that we want them to be respected when they go outside of their room, and we want to offer to help maintain that respect. We want to Another thing, this was very big. I've seen this performed wrongly multiple times, is we want to sit down when you're helping to feed a patient. Not only does this show the patient more involvement and commitment to our commitment to the activity, but it displays a level of compassion, and it opens us up to a personal relationship with that resident. Um, and any signs that may indicate the type of care or disease that the patient has, we should not make them public. We should try not to make them public for other residents to see. We should try and maybe put the sign inside the patient's room, on the inside of the resident's door, or hang it up above their closet. Because again, this may be embarrassing for them. They may not want others to know. I know it, in society, we don't want to wear our disease or any ailments or any handicaps that we have um, out for everyone to see. So we should use that same train of thought when we're caring for our residents and they're living under our care. Now, preserving resident privacy. What do I mean by privacy? Privacy is the state or condition of being free from being observed or disturbed by other people. Now, I touched a little bit on privacy just when I was covering dignity, because as I've said, all of these topics are correlated. They have some connection, some bearing on the next, right? So, privacy, we want to make sure that we're respecting a person's personal space at all times. We want to listen carefully to what the individual residents are telling us. We want to follow their wishes, their feelings, and be sensitive to them at all times to make sure that they're not feeling embarrassed, they're not feeling uncomfortable. Not only is this going to preserve their privacy, but this is also going to preserve their dignity as well. So, how specifically can we preserve a resident's privacy? Simple things, always knocking or introducing yourself when you enter a patient's room, and not just knock and then walk in, but we want to wait for a response or an acknowledgement, something that lets us know it's okay to knock. Okay to enter. Okay. And also ask if the patient would like your presence or prefer you to step out if we are helping them with something such with a self-care act, such as using a bathroom or a shower, or maybe we entered their room and they were exposed. We should ask them, would you like my presence or my assistance here, or you prefer that I step out? If they're unfit to stand or be mobile during the task, that may breach privacy. We should help cover their body, even non-private areas. Just because a woman's breast or a man's genitals aren't exposed, it doesn't mean that the patient is okay with having that area of their body seen by you. Uh, Especially if you're not providing care to that specific area. So if the patient is changing, but they have their underwear on and their pants on, let's say it's a man and he's just putting his shirt on, we should offer to step out until they've finished clothing completely, unless they need our help putting that shirt on. Okay. So just because the, their private areas are covered, we still need to make sure that we're respecting their privacy by offering to step out until they are fully clothed. And last but not least, following HIPAA compliance laws. What does following HIPAA compliancy laws means? That means that we are discussing patient information privately and that it's not displayed for others to see. And it shouldn't be displayed for others to see because we should be discussing it in the privacy of the patient's room with the other members of the healthcare staff or behind closed doors with the other members of the healthcare staff and the patient themselves. Okay. Um, Now, this hopefully isn't a problem at your facility, but just be mindful when we're taking pictures of the residents in a facility that we're asking for their permission to share those photos. And we're not sharing photos uh, or taking photos of one resident to share with family members when other residents are around that specific resident who has agreed to take a photo. We want to make sure only the resident in the photo, only the resident who has agreed to be photographed is being photographed. Um, and we're not sharing that photo opportunity with others who didn't ask. Because it would be a terrible situation for the family of the resident who didn't want to be photographed if they saw that picture on social media or the internet. Nowadays, things uh, can get around very fast online. So we want to make sure that pictures specifically, if a resident is going to be in the picture, then they have all agreed to be in the picture. Um, Shared rooms must have some sort of divider. I know this shouldn't be an issue, but just make sure that if the room is non-private, that it does have a divider, whether it's regardless of what it is, there needs to be some type of divider so that each resident can have their own sense of privacy, their own space. Now, on to choice. Choice, uh, to me, is very similar to independence, being that it is a multi-layered, one of the larger components here that we're discussing to promote residents. And it's very important, but it's unfortunately uh, maybe the least practiced. So choice is the act of simply choosing between two possibilities, okay? And we want to make sure that any activity, whenever the opportunity presents itself, that we offer the patient at least two options, okay? Now, I understand that we cannot always offer the patient two options. For instance, if the patient if well we should and we will always offer the patient two options, but sometimes the options that the patient may want aren't options we can offer them. For instance, if the patient wants to um, take medication that requires them eating or to have food in their stomach but they don't want to eat, we can't give them that option, right? But we can say we can we can give them an option on how much food they eat. We can give them an option on what time they want to eat, and we can give them an option on what time they'll take the medicine. We can give them those type of options, right? To kind of accommodate around their wishes. So we're giving them a choice. We're not just saying this is what we're doing, and this is how it's going to be done, right? Educate the residents of how we will incorporate choice into their daily life, and let them know that some choices that we have are set to maintain flow. So, for instance, a patient can't wake up at noon and expect to have breakfast when the entire facility is now having lunch, right? But we can give them a choice to wake up right before breakfast is closed and enjoy breakfast food. Or we can give them a choice, if your facility allows, to set breakfast items aside for them to eat during the lunch. So we just have to get creative and give them choice, because even though we're there to care for them, we want to preserve that independence. And independence is when you're living alone and you wake up and you want breakfast food for lunchtime, right? So we want to give them those same options. And that same kind of a train of thought applies to clothing selection, bathing and showering time, bedtime, their daily schedule, any activities that are going on. That same level of two options should apply. Offering choice is important because it increases the level of cooperation. So when we offer the residents more choice, they're more likely to cooperate with us across all levels of care, um, says it might actually be less labor intensive for us, because um, staff workflow was often, in some studies, the reason why healthcare workers didn't give residents choice. But those studies suggest that maybe it would be easier to care for or less labor intensive if we offer the residents more choice, and then maybe we would see a reduction in their resistance to certain care events. So that's something to think about, something that I found very interesting in my research, and putting together this presentation. So, excerpt from article that I want to share with you guys here. It says, I'm just going to read the highlighted areas that I have with the specific points I want to touch on. A sound understanding of nursing home residents' perceptions of choice may be one mechanism by which to maintain residents' sense of autonomy. That's another word for independence, and improve overall satisfaction with care. So it's saying here that a resident's perception of their ability to make their own choices can help maintain their sense of autonomy and improve their overall satisfaction with the care they're getting. So even if we're not giving them the best care that they can get at a nursing home or assisted living facility, by simply giving them more choices, they get the sense that they're overall getting better care. That's big. Outcomes suggest that satisfaction of nursing home residents, a critical indicator of success in the nursing home culture, is associated with perceived level of choice. So that's just reinforcing that satisfaction of nursing home residents, which is supposedly a strong indicator of the success of a particular nursing home, is associated with level of choice, the perceived level of choice. Last, patients tend to be more satisfied with their care when they favorably perceive access to health providers, have the opportunity to choose their personal physician. So that's getting into choice again and giving residents the opportunity to participate in healthcare decisions. Even so, as it says here, in choosing their healthcare provider. So, and that comes from an article by Lauren Bangerter titled Honoring the Everyday Preferences of Nursing Home Residents, Perceived Choice and Satisfaction with Care, from the Gerontologist Journal. Now, here, in my opinion, is the correlation between choice. So, choice leads to increased independence and individuality. And privacy is maintained by dignity. So these are just how I see everything playing together. If we can give an individual a sense of independence and individuality by giving them more choice, and we can help maintain and promote dignity by giving a patient privacy. That would bring me to our last component here, individuality. Now, what is individuality? Individuality is a characteristic or trait that is specific to and distinguishing from others. So, just how I said here, choice. If we give a person the choice to be themselves, then we're promoting individuality. And we're also giving them the choice to eat at the table with the rest of the residents or not. We're giving them independence. So, how do you make sure at your facility that you're supporting a resident to help maintain their own unique sense of identity? We can't just assume that every resident is just being themselves, their unique self, right? So, we have to make sure that we're doing things to support and encourage them to be themselves and maintain their own unique sense of identity, not just for them, but because overall, this is going to lead to them making more choices and having a better sense of care, as I demonstrated in the article. Um, they're going to feel like they're having improved level of care because they're having more choice, because we've encouraged them to be themselves. So one example is we can ask the residents, what was your occupation? And ask ourselves how we can utilize the skill or knowledge from that occupation. So for example, let's say one of our residents owned, operated, and worked for their own painting company. So, how can we support that resident maintaining their own unique sense of identity? We could, for this particular resident, if they're physically able to, and if there's somewhere in the facility a room perhaps that's outdated, or we want to create a sign for a Christmas party. We can ask that resident to paint because we know they have painting knowledge. Or we can have that resident oversee a paint committee of residents who enjoy painting. And this resident here just so happened to operate and own their own painting business, has experience with paint, has great choice, has great color choice selection. So Mr. Johnson is going to be the in charge of the paint committee that will paint our Christmas sign. So that is how we're helping Mr. Johnson maintain his own unique sense of identity, because for the past 30 years of his life, that is all he's known. So rightfully so, painting is a large portion of his unique identity. The inability to continue with simple routines and tasks such as cooking, cleaning, or gardening can be demoralizing and depressing. This situation can rob a person of their sense of purpose in life, and they may withdraw into themselves. Supporting a resident to maintain their identity is critical to their happiness within the care home. So, that is exactly why it's very important that we help preserve, maintain, and encourage an individual's individuality. Now, to be more specific, because I want to give you guys specific examples of how each of these can be accomplished. We can make time to develop trusting relationships, not only with the residents, but also the relatives, because this is how we're going to get to know who they were, who they are, and how we can help maintain that unique identity. Um, Consistent staff assignments will enable staff and the residents to get to know each other, because I'm meeting with the same person, I'm building a relationship with them, they're helping me, we're talking every day. So I'm slowly, of course, going to start opening up to them, and they're going to recognize what I like, what I don't like. That's going to make my time here all the better. Learning one another, having time to share through organized activities. And again, I cite the choice of them opting out is just as important as the activities that they choose to participate in. So if they choose to opt out, that's okay. We just need to spend some more time with that particular resident, getting to know them, understanding why they don't want to participate. And that's okay. Free choice should be supported through flexible routine. So we want to make sure that there isn't just one set activity, that there are different activities during activity time, or maybe we've given them a list of activities for the week so they have something to look forward to participate in, so they can make plans, so they can prepare themselves to participate in these activities and make sure that it's flexible routines that they're participating in. And that will be the end of today's presentation. We are now at the quiz. We're going to test our knowledge to see if you guys were paying attention and if you were absorbing the information from today. So, our first question: in the morning, while helping a resident prepare for the day, they ask for your help with brushing their teeth. To help preserve the patient's independence, you should A, assist the patient with brushing their teeth as needed, B, brush the patient's teeth for them, or C, encourage the patient to brush their own teeth while assisting them. So I'll let you guys sit for a minute, decide which is the right action for you to take in this very common scenario which may happen. Remember, this was a level 2 in terms of how we promote independence of the most common daily activities where residents feel like they've lost their independence. Okay, this one was a little tricky, but I know you guys were able to sift through the wrong answers to find the correct answer. And the correct answer is A. Assist the patient with brushing their teeth as needed. If the patient asks for help with their brushing their teeth, our main thing is to always help preserve their independence. So the answer isn't B. We don't want to just brush their teeth for them. And we don't want to encourage to brush their teeth on their own while assisting them. We want the patient to brush their teeth and we want to assist them as needed. We want to assist them as needed. So only if they need our assistance. Maybe they don't need assistance brushing their teeth. Maybe they just need assistance getting the toothpaste on the toothbrush, which early in the morning is sometimes difficult for me as well when I'm not fully awake yet. But I don't need encouragement while you're assisting me. I only need assistance as needed. And maybe by assisting them as needed, we can think of a clever way to help them become more independent. Maybe when we set up their morning towel and toothbrush, we can put toothpaste on the toothbrush for them. Or we can find a different toothpaste dispenser just so they can feel that independence and do that one activity in the morning, start the day off feeling independent. Question 2. Studies show that resident satisfaction is most closely associated with their perceived level of which one? Dignity, individuality, choice, or independence? Which one of these components is most associated with resident satisfaction? Talked about this several times. This should be a no-brainer for you guys. The correct answer is choice. Remember that when we give patients choice, not only do we foster individuality, we also foster independence, and it's like a continuous circle here. So we're giving them a choice to choose to do what they want or what they don't want to do. That's giving them independence to wear what they want, to participate if they want, to be who they are. That's encouraging individuality, and that leads to increased levels of satisfaction with their care which is a critical indicator of success in a nursing home, their perceived level of choice, right? So those are the two questions we have. Our course review, we've talked about dignity among the residents. We talked about independence. We talked about privacy, individuality, and choice. Let's just revisit independence here for a second, just because that was at the beginning of our presentation. So remember that when individuals lose their independence, they experience hopelessness, depression, and helplessness. This can lead to a community with higher care needs, which is less desirable. And remember, some of the low self esteem, uh, loss of independence manifestations we may see here: decreased engagement, weight gain, weight loss, refusing treatment, aggressive behavior. Those are signs that we know someone is actively feeling like they've lost their independence. And some of the main areas where we'll know they need our help would be the most common daily activities. So, eating, self care, healthcare decisions. And there are changes we can make to help them with eating on an environmental, social, and individual level. So, give the residents a meal plan on the individual level. Social, we want to make sure we balance the group that they're sitting with to make sure that the independence levels match or they cater to each other's weaknesses and strengths. And of course, environmental, set the table in advance. Remember, we're there to serve them and we want them to feel less assisted, right? Okay. Um, so that's going to be the end of our presentation today. I want to thank you guys for giving me the last hour of your time. I hope that we can take everything that you've learned here today, apply it to your practices in the nursing home, assisted living facility, when we're caring for the patients inside the room, outside the room, when the patient's not around, the small decisions that we make, they all have a significant impact on the quality of life and quality of care of our esteemed guests. Yes, those elderly members of society that we're caring for are our esteemed guests. So we want to make sure that we're treating them appropriately. We're giving them at least two choices, at least two options whenever there's an opportunity for them to have a choice. And we're not only giving them the option, but we're doing our best to accommodate their choices in those daily decisions that they make because it's their life. We are only there to help them and assist them. Okay. But we don't want them to feel like we're assisting them. We want to feel like we're serving them because they're independent enough to do those activities on their own. I'll see you guys next time. Again, my name is Deontay J. Marquis, family nurse practitioner, here educating you on behalf of my ALFtraining.com. I'll see you guys next time. Thank you.